Hello, everyone. Thank you for joining. Both Sanjeev and I. Firstly, can you see my screen? Sanj, is my screen showing?
Yes, it is.
It's brilliant. Good stuff. Okay. Well, thank you for joining, everybody. We know how busy everybody is, so we're gonna push through this as quickly as we can. We'll run the same format that we do with all of our webinars, in that we'll go through the product and an overview of what MyBotGP is, and the reason why it's scaling so quickly in primary care. We will show you a list of pathology tests as well. Some of our clients are filing over 131 different pathology tests using MyBotGP, including subtests and so on and so forth. We will run through the logic, and we will also explain how it works and how it will interact with your system, be you using EMIS or SystmOne. If you have any questions, that's great. We will get to those at the end. Please pop them into the chat. And then once we've gone through the overview, showing you the overview of the logic that's used, a bit about our company, some examples of pathology tests, and we can get to the questions as well. There's a lot of people on the call, so there may be a number of different questions, so we'll go as quickly as we can. Afterwards, as we do with all of our webinars, we will save it, share it, put it onto YouTube and share it as well. So if you want to have a copy of it, then you'll be able to access it there as well. So good stuff. So nice to meet everyone. Thank you for joining today. What we're going to do today is give you an overview of our normal pathology filing tool, which is part of our MyBotGP range. MyBotGP are purpose-built products that are built for primary care. They are ready to use straight away and completely bespokeable at practice level. The reason I'm starting this webinar by saying that is because that's super important for primary care, especially when it comes to things like pathology filing. We also have a document filing tool for EMIS. Obviously, pathology is for EMIS and SystmOne, and a repeat prescription filing tool as well. Everybody does the same thing in a slightly different way. Different people have got different opinions on how to address the same problem. And with the MyBotGP range, you're able to bespoke the tooling at practice level. So what that means is, if you buy this tool just for your practice, you can tweak it to follow the rules that your partners would like it to follow, in order to filter on what pathology test it's allowed to action and what pathology test it isn't allowed to action, and what rules to follow. However, for the digital transformation leads and clinical directors for PCNs on this webinar, it's important to share that if this is acquired as a PCN, each practice, if you want, would still have their own copy, which means you don't have to all share the same rules. You can bespoke it as you like at practice level. The reason that's important, as I touched on before, is because different people have got different opinions on how to do the same task in a different way. The example we normally give is prostate. We've got lots of clients that prefer to filter prostate lab tests based on 5 ages and 5 ranges. And we've got lots of clients who don't want to follow that logic. They want to do a default check against the previous test result, even for a normal result, to check for a percentage increase or decrease. And obviously there's keywords that can be used, and so on and so forth. Sanjeev and I will take the webinar today. Sanji is more on the technical side of the tooling, and I'm more on the operational side of the tooling. So hopefully between us, we've got everything covered. If you have any questions, obviously pop them into the chat, and anything that we can't answer in the webinar, or if you would like further information, we can deal with that afterwards. Hopefully you'll have received an email from all of us, from Deandra, and obviously we'll email everyone a copy of this as well. So what is MyBotGP? Essentially, this range is the most advanced automation range for primary care. And the reason we say that is because it's quick to download and bespokeable at practice level. Our tooling has a DCB 0129. That's important because it's an NHS certified clinical risks, an NHS clinical risk certification, of which we have. So that ticks a box. What it means is it's been checked and deemed fit for purpose. Can you hear me? Sanj, can you hear me?
Yes, yes.
Yeah, sorry, was my mic muted or?
I think just for a couple of seconds, yeah.
So do you know where I got to? Or?
DCB 129, clinical
Okay,
risk.
fine. So thanks. So we have DCB 0129. We're working with hundreds of practices, PCNs, and federations nationally. You know, highly bespokeable at practice level, as I touched on before. It goes without saying that we can complete DTACs, DPIAs where appropriate. This is quite some time back now, but we can share that we completed a digital health launchpad program, which is an NHS and government funded program for launching innovative technology in healthcare. We completed this program, I think, 18 months ago now. So what's the challenge? The challenge is essentially that you've got lots to do. And when it comes to normal pathology tests, there are vast numbers of pathology tests which are normal. And what is normal? Well, normal is if your partners believe they're normal. And how do they believe they're normal? Well, they make a decision as to whether they're normal by applying logic. And I'll cover off what that logic is in more detail in a moment. But basically, they look at them and say, you know, does this person sit outside of the remit, and I need to review their test independently, or is the test in range or out of range, or has it increased by a certain percentage or decreased by a certain percentage from the last test result? Are there keywords I need to look for, or omissions of keywords in order to see whether this is normal or not normal? Do I need to take age or gender into account when validating this? So when they're reviewing the pathology test, that logic is spinning in the back of their head for a large portion of them, not all of them, but a large portion of them. And if the tests are within range, or haven't increased, or haven't got alarming keywords or omissions of keywords, and so on and so forth, they're classed as normal and wouldn't require further investigation. If they don't sit in that remit, excuse me, then that's then they're not normal, and they'll be left to be validated by a doctor. So if you revert that back to what the challenge is, so on average at the moment, an average list is about 8,500. And in fact, I believe that figure is now higher. Probably more in the region of 9,500 now, and they're receiving approximately 200 pathology tests every day. So believe it or not, that's a staggering 62,400 pathology tests a year are being manually reviewed based on normal or abnormal, and that includes the pathology tests that come through from the lab. And the labs say are normal, whether your partners agree or disagree with the labs and want to add additional logic to those. Now, with some of our clients who are up to sort of 130 plus different pathology tests, you can say that approximately 30% of those are classed as abnormal. So in this particular scenario, what does it mean? It means that, believe it or not, over 43,500, it's about 70% of pathology tests could potentially be classed as normal, no action. And yet you're still manually reviewing them. So MyBotGP can do this for you. So if you think about it, what automation is here to do is not to think or make different decisions as to what our people do. It's essentially enabling our people to tell it what to do based on their logic. So you say to a bot, look at this test. If it's within this range and it hasn't increased by this percentage, or it hasn't got this keyword, I'm happy to not physically look at it myself. I'm happy for you to pass it. And that's what MyBotGP does. So there's obviously issues with funding at the moment, short on time and staff, increased lists with more health conditions. There's also potential errors, and a lot of our clients quite like enforcing standardization. So you can have lots of different people working at a practice, but there are some enforced standardization as to how pathology tests are managed, and essentially you can get a lot of this time back. So these are the rules, which I'll come back to in a second, but I just want to sort of paint the picture first of how MyBotGP works. So think of it as a person. You have a person that has its own username, its own user account login details for EMIS or SystmOne, whichever system that you're using, with its own login. So there's a full audit trail, and it will log into SystmOne or EMIS. You will tell it what pathology tests it's allowed to filter against, so it will navigate its way to where your pathology tests are kept in the global inbox or wherever it is at your practice. You've given it the rules to follow, i.e., for this particular test, I only want you to look at range. For that test, I want you to look at keywords and range. For this test, there are no ranges, just look at keywords, and so on and so forth. We'll come back to the rules. It will look at them and it will open up each one and read it one by one. And then for the path tests, it's been given permission to action. It will action them based on those rules, and then it will move to the next one, the next one, the next one, and it will work its way through the inbox. Obviously, it can send text messages as well, either directly through to SystmOne or through Accurix. Everything is marked that it touches, so there's a full audit trail, and obviously you can see as well, and anything that's abnormal it will skip. So in principle you're left with the abnormals. Now rules can be changed at any time in minutes. Why is that important? Well, we put that on there because it's really important. What we've seen with our clients is fairly regularly they change their mind, or labs change ranges, or they change keywords. So being able to just log in and adjust it within a couple of minutes is super important. And there's a full audit log as well, comprehensive audit log. So you've got a copy of absolutely everything that it's done. So MyBotGP will get all the ranges from the lab. It reads all the path tests directly from the lab, saves them all in the computer, saves them all in its brain, and then you will log in and agree or disagree or add additional rules where appropriate. So it's pretty quick to get up and running. So what are the rules and the features? So coming back to the important part, how does it work and what logic does it use? So you can configure pathology tests based on any combination of the following decision points. So minimum and maximum range. Is it in range or out of range according to your lab? Now, one of the points further down here says you can supersede the lab. So and that's possible as well. So if you have some path tests where you don't agree a normal is a normal or an abnormal is an abnormal coming from the lab, it's possible at practice level to adjust the ranges to accommodate that. Some of our clients do for some path tests, some don't, depending on the labs and the ranges and personal preference. Check against the previous test result for a percentage increase or decrease. Well, what that means is pretty much what it says. It will open it up. It will read the path test. If you've told it for that path test to go back and look at a last path test for a percent and do a calculation based on a percentage increase or decrease as a buffer zone to make a decision if it needs further investigation, it will do it. It will open it, read it, go back and compare. Keyword checks or absence of keyword checks. HbA1c, for example. Does it say diabetes on the problem page? Thyroid, does it say cancer? You can tell it to look for keywords or omissions of keywords. And as I touched on very briefly before, there's also the ability for a lot of path tests don't have ranges and only have keywords. So you can tell it to work only on the keywords. Separate ranges or checks again for age and gender are also possible as well. So as I touched on before, you can supersede the lab ranges. Nothing is removed from the system, which is really important. So there's a full audit log of absolutely everything that it does, gets emailed to you every day. And you also have a copy of it kept in MyBotGP itself. And you can SMS patients as well. So what does that mean? If we come back to this slide here, as I touched on before, you've told it which combination of rules, like could it just be that one or that one and that one, or all of them. For each individual pathology test, you want it to filter on. And again, we've got clients now using it with 131 plus different pathology tests. Not all of our clients, some are happy at 90, some are happy at 100, some are happy at 70, some are at 131. Everyone's got their own opinion as to which ones can be looked after by MyBotGP, and that's up to you. We're not here to tell you what path test to include. We'll share with you a copy of a spreadsheet with an indicative list to show you what some of your colleagues are using it for across the NHS, and then it's up to your partners at your practice to say which ones they want to use it for. And it will log in and it will apply the rules or combination of the rules and make a calculation and come back. What I'm going to do is quickly show you this slide as well, and then I will talk you through the spreadsheet, which I think you've had a copy of. I think Andrew will have shared a copy of that with you in a bit more detail as well. So we've made it very user friendly in that all you can see here is drop down menus and changes. You could just click on things and change it and press save. So let's say, for example, that came from your lab as a liver function test result. So for this scenario, MyBotGP has read your lab report and saved this in the memory. When you open it up, it says, look, this is what your lab says is normal for a liver function test. Now, if you are happy to always file it based on that, i.e. you don't need to add any additional checks, and if you get a lab path report from your lab that looks like this, file it. All you would do is tick that box, file for normal report. Excuse me. And then every time it sees a liver function test like that, it will file it. Now, every time it sees a liver function test come in where one of these ranges are out, it won't file it because it's no longer matching the remit that you've defined as normal. Now, in addition to that, if you don't agree with this, or you do agree but you want to add additional logic, you don't click that box. What you do is you have the ability here to say, do I need to check for a keyword, or a keyword in the problem page, or no keyword, or a keyword present? You would simply click the appropriate box and write the keyword in. Do I want to change any of the ranges? Yeah, maybe you want to change this one or this one. You click on it, write the new range, and press save. Or do I need to check against the previous test result? Yeah, let's say, for example, here, I want to for this one. So you click yes, previous test result, check against it. And I'm only happy for a buffer of 5%, and put 5%, and it will perform that calculation and either pass or fail on that principle. Do I want to send a text message? You can do that individually at path test level. Yes, click that one, or no, I don't need to send it for that particular test, but maybe for general health checks or maybe other tests you do. Yes, it's up to you. And then obviously you can file with or without comments. So all this is great. What does it mean in reality? What it means in reality, and I'm going to share this with you now. I believe you've been sent a copy of it. Just give me 1 second. Okay. What it means in reality for the clinicians on here and the people that work with pathology tests. Here's an indicative example of what pathology tests are being filtered against with MyBotGP. Okay, we're making it pretty clear here. We're not saying this is, something that you should copy, but this is a list of pathology tests that your colleagues, some of your colleagues, well, all of your colleagues that are using this tool or clicked together are using MyBotGP to filter against. And again, it's any combination of the following rules can be applied: range, previous test result, increase of keywords, omissions of keywords, age and gender. And what you can see here is a snapshot of a collection of pathology tests that are being safely looked after by MyBotGP. So what you've got here is test category, gender, age, ranges, previous test result checks, keyword checks, filing method, and comments. You can see what those rules mean in reality. So if you think of it the other way around, the right way around to think about this is, you've got those rules. What path tests can fit into those rules? And the answer is, well, we've got clients with 131 plus. You can see here. And again, just to reiterate, you can set multiple rules against each pathology test. It's not one for one. You can have multiple checks. The demo, the one I always like to show again, just because it seems to be a particular bone of contention, is this one here. You can see for prostate, 5 ages and 5 ranges. See lipids, interesting one here. So how does it work? Well, we essentially we give it an EMIS account or a SystmOne account. It will go to your pathology tests. It will read all of them. It won't action all of them when it's new. Save them all in the memory, because to be safe, it's got to grab all of the ranges directly from the lab and the names of all of the path tests. So it does it all completely by itself. You don't have to do anything. And after a few days, it might have picked up 40, 50 path tests. After a week, it might have picked up 70, 80, depending on what variety you get and how often you get them, and obviously the size of your practice. But after a couple of days, generally it's picked up quite a bundle of path tests. And then it saves them all in the memory. And then it is simply a case, as I just showed on the slide before, of you then opening it. We open this thing here, double click on each path test individually. I believe they'll be in purple or red, whatever the color is. Opening it up, and it will show you this panel. And then you say each one, do I agree with the lab? Yep, tick. Okay. Next one, open it up. No, I don't want to agree with the lab, or I do agree with the lab, but I want to add another check. And then, as I said before, keywords or ranges or previous test result, age, gender, filing with or without comments. You add your logic and press save. It's 20, 30 seconds to do it once you've decided on the logic. So obviously you need to have a think about the logic in advance at practice level as well that you want to apply, and then you can whiz through them quite quickly. Generally, our clients go live with 30 or 40 quite quickly. And then what MyBotGP will do is every day it will send you a snapshot of everything that it's done, and it will also say, oh, and by the way, I spotted another 15 path tests in the lab reports section that I've never seen before. What do you want me to do with them? You say, oh, okay, fine, add those ones. Happy with the labs on that one, change the range on that one, change the keyword, add a keyword search, whatever logic you want, press save. And then the next time it sees that, it's been told what to do. And then every day you'll get another email. And after a while, it will saturate, usually 2 to 3 weeks, and it's seen pretty much all of the path tests, and it will just keep working in the background. If a lab changes a range and they haven't notified you, or a keyword, or the way something is written, then it won't recognize it, and it will pop up on the report and say, I've just seen this for the first time, never seen it before, what do you want me to do? And again, you're supposed to be given forewarning for changes of ranges and labs and stuff like that. If you're not, and then all you need to do is open it up. It's locked down with the username and password. You double click, open it up and say, okay, new range is this, and press save. From a compliance perspective, obviously we have the DCBO 129. So this tool has been, has passed the correct audit trails. And then obviously it goes without saying at practice level, you need to make sure you understand how the tool works properly, and run regular audits and reviews in whichever way you deem fit, to ensure everything is safe. So what I'm going to do now is, another slide here. This is a very, very basic picture of a snapshot of the audit log. We could do an hour on the audit log again, but it'd be quite boring, but important. But needless to say that everything is tracked on the audit log. Every pathology filing by date, category, and then an anonymized granular breakdown of the patient, be they EMIS or SystmOne. So there's no mystery or no secrets as to what logic was applied against each path test applied to the patient. What does it mean in terms of time saving? Well, people perceive time in lots of different ways. I like to give this analogy. Humans aren't very good with time. We just work. If you've always worked that way, you just have always worked that way. But if it takes you about 15 minutes a day to have a couple of coffees, 2 to 3 coffees a day, some people that'll be 2 coffees, some people that will be 3 coffees. Excuse me, that works out at 91 hours a year, just making coffee based on 2 to 3 coffees a day. So you can see how just clearing the normals every evening isn't a quick fix. People think it is. Yeah, I'm just going to blast through the normals and get them done. It took me 20 minutes or half an hour or 5 minutes or an hour across multiple partners in each practice. Well, unbelievably, it comes to about 1.5 days worth of clinical time per week in an average practice, just clearing normals. So based on 4 partners, that can be as much as 19 days for each partner, 78 days a year, clearing normal pathology tests. So clinical cost saving, freeing of clinical time, enforcing standardization, make work less monotonous, improve patient care, let you get to the abnormals quicker or other tasks quicker. Costings are quite straightforward for us. It's a very simple calculation. We charge $4.99 for MyBotGP. And then the price for the product itself is your list times 30 pence. So based on a 10,000 list, 10,000 times 30 plus 499 is 3499 plus VAT for unlimited pathology tests. And it can be changed as many times as you like, and it can run as much as you like. Our pricing is the same for document. For those of you using EMIS, unlimited letters and unlimited letter types. We have clients with over 120 different letters, 130 different letters, I believe, and being pushed through the system. So before we move to the demo, are there any questions? Sanj, can you see any questions in the chat?
Um,
Oh, you're muted.
Nothing. There are no questions, James.
Good. Okay. Brilliant. Okay. So let me just go to just before we move to the next thing, just to again show this, because I think it brings it to life. Obviously, we'll share this after the call, unless you've obviously had it already, along with a copy of it. And it's just to show sort of real world how those rules are used. This is another combination of pathology tests, slightly different. Let's open up here. Another one of our clients. Quite similar logic, but there are some differences. These practices, well, when they shared this with us, they were at about 104, so that may be higher. So when you think about MyBotGP, think about quick to use. You can change it whenever you like. Unlimited pathology tests, and it's about the rules. How do you incorporate which pathology tests can be safely looked after by replicating the rules a person would be thinking about when they're manually reading the pathology test. Are they looking at it based on range? Are they looking at it based on keywords or change, and so on and so forth? They've chosen to use the same approach for prostate. Not everybody does. And again, it's completely up to you. If we come back to this now, we've got an EMIS and a SystmOne demo. Front page is the same for both, so I'll start with this one, but we can show both. Hopefully it will play. Let me just take this to here. I'm going to pause this in a second. So what you're seeing here is, pause it now, essentially the same as what we just shared on the brochure. It's just what it would look like on your computer when you log into the application. So let's say that's what's come from your lab for a full blood count. And just to reiterate, because it's really important, the spellings of all the pathology tests and all the ranges that are there for this scenario have been taken directly from the lab. We haven't asked you to go and confirm the ranges or the spellings. These have come directly from the lab. And that's linked to our DCB 0129 to show that we are able to do that correctly. These aren't any new or different ranges. This has come from your lab. So if you agree with those ranges for these particular tests, file for a normal report. If you don't. Click that. Obviously, you can send a text message. And then quite simply, this is how you add keyword checks, emissions of keyword checks, change any of the ranges. And let's say, for example, hemoglobin estimation from you wanted to check a previous test result, look for a percentage increase or percentage buffer of 10%. You just write that, press save, and that's it. And now every time it sees this test from your lab, it's going to compare it against all of these ranges. And for this one, it's going to do an additional check. And obviously, if any one of these fails or is changed, it will fail it and say, no, that's not for me anymore. That's now for a doctor to look at. Everything gets filed against the patient record, as it obviously. So here, what we're showing is how the keywords can be used. So we have an HbA1c test here. What we're saying is you wanted to send a text message for those. Maybe you do, maybe you don't. Some practices get lots of phone calls from patients double checking whether the results have come back in when they're normal because they don't know they're normal. So you may want to send a text message and you're saying keyword absent in the problem page. Does it say diabetes in the problem page? And it will read the problem page and look for the word diabetes. Obviously, you can add additional rules as well. We'll just show a couple of other examples, all relating to that spreadsheet. But once it's set up, and you don't have to set it up in one go. Most practices go live in stages. Whilst they're building confidence with the tool, they'll start with, as I said before, 30 path tests, run it for a week, log in again, add another bundle, run it for a couple of weeks, become used to working with a tool like this. Share messaging at practice level for other partners and clinicians to not file the path tests and let the bot do it. And then eventually they start to get to quite high numbers of different tests and it's just running in the background seamlessly, processing everything it's been given permission to do. It's just part of the setup process. I'm going to stop this one now. And then think of MyBotGP, as we were saying before, as a person. It's just going to log into EMIS or SystmOne. It's going to know what buttons to press and in what order. We're on a test run here at the moment. A lot of this stuff has been anonymized, whereas one of our clients let us record this for demo purposes. And what you're seeing now is MyBotGP logging in. It can be scheduled to run at different times of the day or night. You can set a schedule to schedule in advance of that. It's going to log in. It's going to navigate its way to the right page. It's going to open it up. It's going to look for the path test. Again, a lot of this stuff has been redacted, but you can see it working in the background. It's going to pull out the path test. It's going to look for the ones it's been given permission to action them based on the rules that it's been given, and skip the ones, well, either pass or fail them, or skip them and move to the next one. And all you're seeing now is like a person, for want of a better word or description, just using EMIS in exactly the same way. And then obviously at the end of each day, you'll get a full audit log saying what it's done, and everything is saved in the memory in more detail in the actual application itself. It's quick to start using. We just need to username and password essentially, and you need to have a think about what rules you want to add. And we can share the spreadsheets. And invariably, lots of people generally start with the lab normals. It's a nice, comfortable, safe way that they feel safe to start using it, and then start to expand upon those as they build confidence with the tooling. And it just runs in the background. I'll let this run for another minute or so, and then we can come back and see if there's any questions. If we've got questions, we can go through those. If not, then yeah, then that's good as well. It means I'm describing it properly, hopefully.
We have a couple of questions, James.
Oh, good. Okay. Saj, do you wanna read out one of the, or shall I? What the question is? I can't see it on. Can you see it there?
Yeah. The first question is, do we need to inform patients that we are using this? We are sharing data in any way. I can take this one.
Yeah.
So I mean, it's a good question from a data privacy perspective. As you can see, the automation doesn't actually store any PID, any personal information. What it does, it processes like a human, where it picks up information and checks it against specific ranges and logic, but in no way does it store or hold or share any personal information. And also the filing of pathology test results is within a patient's reasonable expectation in terms of delivering care. So again, you wouldn't necessarily tell patients if a clinician or a person was filing test results. Just on top of that, obviously it's slightly different in a different way. There is an SOP, a standard operating procedure manual that one would apply at practice level, and it's just a case of going through those checks, making sure that the tooling is doing as per what it needs to do.
Thanks, Ange. Next one.
There's a second question which says, can the bot be installed on a normal everyday PC in the practice, or requires a dedicated PC just for the bot?
I can answer that one. Yes is the short answer, no is the longer, or rather the other way around. In principle, it can work in that way, although we're now moving to a cloud only option, whereby we're gonna provide a virtual machine. Obviously, there's a small cost to that, so you won't need a physical machine at the practice. So there's the primary care is quite challenged in terms of technology. As you know, you're not blessed with the most newest tech, but I'm pleased to confirm that this is starting to change, and you're now starting to get access to sort of hosted machines and virtual machines, which essentially are the same as your laptops, but just not sitting at the practice. They'll be living in the cloud somewhere in a safe environment that anybody can log into at any time. So we're moving to a cloud-only offering. So if you'd have asked us that question a couple of months ago, it would have been yes. Now it's like yes, but we want to go cloud-only as we think it will be longer term, more efficient use of your time when using it. And obviously, this is all about saving time at practice level. Sanj, any other questions?
No, not at this stage, just a couple. That's it.
Yeah. Okay. So if anyone's got any other questions, please pop them in the chat. We can hold on here for another couple of minutes. If not, then obviously we can round things up and give you some of your time back. So I can't see the chat at the moment. I'm just watching a robot running in the background. So if you
Nothing as of yet.
Okay, we'll just give it one more minute. Okay, so we'll start to wrap up now. In summary, MyBotGP is quick to install, cloud offered. It can be acquired at practice level. It can be acquired at PCN level. If it's acquired at PCN level, each practice will still be able to set their own filing rules. Maybe you've got differences of opinion at practice level, or maybe you are being supported by different labs that have got different ranges or different keywords. It takes all of the lab ranges and spellings and names directly from the lab, so it's safe in that regard. You're not trying to and quick. You're not having to go onto Google and try and work out what the ranges were. Take them directly from the lab, and you can quite quickly double click on each path test and either agree with the lab or supersede it with additional checks. Age, keywords, ranges, so on and so forth. Like our document filing product for EMIS, I know this product is available for EMIS and SystmOne, but like our document product, it's unlimited pathology tests and volumes. And we've got clients, as I said several times in this webinar, with over 131 different pathology tests. So it's around saving cost and time and enforcing standardization. The tooling has a DCBO 129. And maybe we toyed with putting a page in our brochures of someone having 2 coffees a day and a picture of 15 minutes. I think you really need to think about time. Everyone's used to working how they're working, and things that quite often don't feel like they take much time take a lot more, and things that feel like they do take time actually take more time than you even thought they did. 15 minutes a day is 91 hours a year. That's 8-hour working day or 9-hour working days. It's a lot of time. Yeah. So okay, if there's no more questions,
a couple of more have come in.
Okay. So do you want to share my screen here?
Yeah, about 4 or 5 new ones.
Okay, right. Okay. So is there a way of highlighting patients where we want to see normal results? So they're not highlighted, but our advice to follow on that in that regard from our clinical safety officer is we don't. It's a generalized way of saying it, but I think you'll all understand what I mean. We don't have any input onto how you empty your inbox or how you archive. So the way that is looked at is at practice level. You can set your own auto archiving or removal of essentially path tests, so they're still in there. What we do is we mark everything, or MyBotGP will mark everything that it's seen. So an example of that is we have some practices where they just archive everything straight off the bat. We have other practices where they don't, and they archive at different time increments, and they cast their eye over things. I'm just going to go back up and see there. I didn't miss a question. The 499 fee is every year. Yes, it's a subscription-based program. Can the program be used to identify abnormal results and send accurate messages to book appropriate appointments, thyroid tests that require medication, titration? So some of our clients, so it's built to be a normal pathology filing tool. We are in R&D stage, quite advanced stages of building an abnormal pathology filing tool. Probably be ready near the end of this year, I would have thought. But this is classed as the normal. What we've seen, we've had some clients for particular pathology tests have set different ranges to pick out the abnormals because they believed it could save time. I'm not going to try to explain what they've done or how they've done it, but essentially it's up to them at practice level for particular path tests where they felt that they could pick up a different range and send out a tailored message. Some have done that, but from our purposes, and this is a normal pathology filing tool, it's built to file normal pathology filing test results. I hope that answers that question. Does it know when all request tests are back and only send an accurate once they're all back? Okay, it's an interesting question. We get asked that fairly regularly. I believe that question is asking if there are 10 tests, for example, would it wait until the 10th one's back before sending a message? So if that's the question, which I think it is, no. That's quite challenging. If you think of logistically around the accountability of trying to do that, you'd have to build out logic around, what happens if a test gets lost? What's the average waiting time for each particular test, times by 10, and build out whole algorithms on the back end that could say, okay, you can wait 3 days for this test, but the lab might come back in 2 days for that, 6 for that, if this isn't lost, and then differing messages to be pinged out off the back of it. So it starts to get dangerous, in our opinion. So we send one message, one path test as it gets in one by one. And what we've actually seen, especially more recently, as a lot of practices aren't receiving the same funding for pathology tests, is they're narrowing down which ones they want to send text messages for. That's actually reminded me something else I forgot to say earlier in the call. The other thing that we do here, we just launched this year, is we're running, as part of our training, we run weekly training webinars for all of our clients every Tuesday and Thursday at 1 o'clock for our tools that will run every single week without fail. And anyone that is a client of ours could drop into those. I believe Tuesdays for pathology, Thursdays for document, and repeats or prescriptions will go on another day, where clients get together, can compare notes, and we can share the latest updates on how to get best out of the tool. Have you started offering the bot in the cloud? Yes, we have. Yes, 100%. We are going cloud only now from this year. We're only transacting MyBotGP in the cloud. You'll get your own virtual machine in a safe environment. Obviously, NHS fit for purpose, and it will log in and out. Is there any more questions? If you have any other questions, please pop them in the chat. Okay. So good. Okay, I think everyone's still on who started, which is great. Additional cost for the cloud system, we'll pop that over afterwards. It depends on the number of patients that you have. Trial periods, we offer a 6-month paid trial. Generally, our contracts, our agreements are on a rolling annual contract. Okay, good. Okay, I'm pleased that pretty much everyone that started is still on the call. That's a good sign. If there's no more questions, what we will do is finish now, which is great. We will save this. We will put it onto our YouTube channel as promised. Just give us a bit of time to do that. And then we will distribute a copy of the recording to everyone afterwards. Obviously, if you have any questions, please come back. Yeah, and thank you for attending, and I look forward to hearing from you. Sanj, you want a quick goodbye?
Yeah, no, thank you all for attending, and any questions, please just reach out.
Good stuff. Thank you very much. Thank you.
Thank you all. Thank you.
Cheers.
Bye-bye.
Thank you. Bye-bye. Bye-bye.